Good afternoon. Welcome to the local Blackhawk County Emergency Operations Center COVID-19 press briefing for today, April 27th. Today's press briefing is being offered to our media partners by Zoom, as well as Facebook Live. And today will actually be our last live press briefing. We did a soft open basically on Thursday, kind of a test of this virtualization effort, and that was successful. Today we're doing it again, and we're actually incorporating one of our speakers via that Zoom technology. And so once that successful test has been determined, we are going to go ahead and discontinue the live version of this and invite you all to participate via Zoom. The way this is going to work is in an attempt to encourage social distancing and improve our level of communication and reach, and to better keep you as our media partners safe during this COVID-19 surge. We are going to ask you to join us by Zoom. For those of you that are participating via Zoom, you will be muted and probably already are during the meeting. You will have the opportunity to ask questions after the speakers have completed their portion of their prepared remarks. If you are on a computer, we ask that you raise your hand, and that's kind of in air quotes because you have the opportunity to do that with a function key. Or you can put your question in the chat box, and that question can be asked that way. If you are a dial-in participant via phone, you need to press *9 to raise your hand as well, and you will be given the opportunity to ask your questions as well. We have moderators here to do that for you. So barring any questions with regard to how we will facilitate that, that's the way we will move forward. The other thing that we will make every attempt to do, and I've briefed the speakers on this, that as we move forward, we will try and repeat the question that is asked of us, or I will try and facilitate repeating the question for whichever participant is going to answer the question so that we can make sure that it's well understood what the question is that's being answered. So today we are bringing back all of our directors and medical experts because we have significant numbers to speak about today and to give briefing on. So without further ado, it is my pleasure to bring back to you our Incident Commander and Director of Blackhawk County Health, Dr. Nafisa Sisia Bonye.
Good afternoon, everyone. So as of Monday at 12:30 p.m., there is a total of 1,346 reported cases in Blackhawk County. We also have identified a long-term care facility outbreak, and because they've allowed us to release their name, it's Harmony House. We had an additional death, making it a total of 11 deaths. And as always, my sincere prayers go out to the families. Of the cases, we have 261 people recovered, and a total of 43 individuals have been hospitalized. The majority of our cases are between the ages of 8 through 40, which was it was 46%, and 41 through 60, which is 43% of our cases. And 58% of our reported cases are males. We are working to provide additional data that can be published and available on our website. So today, I continue to urge all Blackhawk County residents to continue to stay at home. Our region of the state is still increasing, seeing an increased level of illness. Social gatherings should only be done with people who live together in the same household. Please continue to stay at home and practice social distancing. We've received calls regarding golfers not practicing social distancing. Golfers, you have to be a model for the community and our children. Playgrounds are closed for kids, and it breaks my heart to see the playgrounds empty, especially when it's sunny and beautiful outside. So I ask all of the golfers out there, please practice social distancing and be an example for all the kids who are not able to play on the playgrounds. Over the weekend, I was in communication with Tyson. Tyson has indicated that they have completed team member testing. The test results are being processed by the state hygienic lab. Tyson will communicate directly those results to their employees. Tyson informed me that they share in their commitment to their team members' safety and finding the right path forward for the Waterloo plant. Again, community, it's just very important right now for us to continue to stay at home. I know earlier with the governor's press conference, there are some counties that are opening up, but we are still seeing a surge. We are still seeing an increase in cases. So I ask all of you to please continue to do your part and stay at home. Leave your house only for essential services. Continue to wash your hands frequently, covering your mouth and sneeze with your upper arm or tissue, and continue to clean and disinfect frequently touch objects and surfaces. To all the frontline staff, especially to our healthcare providers, thank you for everything that you are doing. We value every single effort you make to save every life. This is a very difficult time, so if you see me emotional, it's just because it's very difficult, and I want everybody to take this very seriously. COVID has had a huge impact on the community. The numbers that I have indicated, 1,346. That's 1% of the population in Black Hawk County. So we need everybody to work together so that we can fight COVID-19 together. This is not one organization, one professional field. This is all of us. So I want everybody in the community to continue to take this message seriously. As much as I hear, with the communication that things are opening up, what I'm asking for Black Hawk County is to please continue to implement these preventative measures. I need you all to not give up. You need to continue to have hope. I know it's been very difficult, but please do not give up. By staying home, you are saving a life. So please continue to stay at home. And when you are safe, when you are at home, you are safe and you are saving a life. And most importantly, my message today is that we will overcome this pandemic together. We'll get back to our normal routine, and we will overcome. Thank you, and stay well.
Today I have just a couple of comments because Nafisa allows me to. Today we're at 1,346 cases detected and 11 deaths. 7 days ago we were at 356. 14 days ago we were at 62 and no deaths. 1% of our population is now infected, and that's the 1% that we have tested and that we are aware of, that we know of. And we know certainly there are more asymptomatic and people that have not been tested that are still out there. Yet I still see adults out there not wearing masks. I see people not social distancing. I hear and read comments about how not wearing your seatbelt or the common flu kills more people. Well, not wearing your seatbelt is a ignorant choice. And I suppose so is not wearing a mask or not choosing to stay safe at home, particularly right now when 1% of our population is being affected. I hear Corporate Tyson talking about how this community COVID spread is impacting their operations. And it makes me want to jump up out of my chair to say their operations is negatively impacted the COVID spread in my community. Our first line of defense was, and still quite frankly is, our community and our community partners. And when that defensive line fails, we then rely on our healthcare specialists our long-term care facilities, our nursing home staffs, because that battle then falls on their front doorstep. And that's precisely where the battle lines have now been drawn. And this too frustrates me, because now we're bringing the battle to the most vulnerable of our population. With Test Iowa, we add capacity, we add resources, and we add additional testing capacity to our clinics and our hospitals, and that's all good stuff. But it's all unnecessary. We should not be sitting where we're sitting today. And that too frustrates me. So when I hear ignorant comments and I see people doing dumb things, things that put the rest of us at risk, things that put themselves at risk, it causes me to question why we work so hard. Why should people put themselves on the line each and every day? I think about those hospital workers, those ER workers that show up every single day knowing they're going into the lion's den, knowing they're going to the heat of battle every single day. When there are people out there that simply do not take this seriously. And the chances of people dying are probably slim. That's probably true. But this is an unnecessary fault. This is an unnecessary evil. This is an unnecessary risk that people are knowingly putting themselves and exposing themselves to. And that's frustrating. And while Dr. Nafisa is too polite to say it, I'm not. At the end of the day, we continue to fight this good fight. We continue to champion and rally the community. We continue to say it like it is, to try and encourage people to realize how serious and how real the stakes are. You can't jump 500 people in testing positive and not have somebody stand up and say, listen, folks, this is real. We can't let it sit without comment. Today should be that wake-up day because we're over 1,000 cases. We're almost double the second highest county for absolutely no reason. We need that community line. We need that community partnership. We need those businesses to step up. We need those who are not doing their part to step up and start doing their part, to lead by example, to set the standard for our youngsters to pay attention to. This is how we get through it now. That's what I have to say today. Next, it's my pleasure to introduce you to the Chief Medical Officer for Mercy One, Dr. Matthew Sako.
Thank you for your time today. I'm here to talk about a few things going on. One, our televisits continue. We're trying to socially distance and still connect to our patients. And those are growing and continue to be a good service that we can provide to those patients and help them. We also, our fever clinic, our testing has increased quite a bit. It's slowed down the last couple of days since the Tyson workers have been tested. We had a fair number of those, but we still see a fair number of patients at that to provide that service to the community. We are concerned about the safety of our staff and our providers. As this continues in the community, in our emergency room, on our medical floors, in our ICU, our staff have worked very hard. Our physicians and nurse practitioners, PAs have worked very hard to protect themselves, to protect other patients. But it's a very scary time for them. Patients that do end up on ventilators don't do well with COVID. In New York, 90% of them passed away. So we see some of those numbers here in the local community as we talk about the 11 deaths that have occurred. But as we do this, we are starting to look at what the governor has talked about, our recovery plan, to how we can get more surgeries done for the patients that need those, and how we step through that. We have looked at what she put out in her documents on Friday. It does take that we are seeing less positive tests, less than 10% in the community, so that we could move forward. Making sure we have enough PPE, enough protection for the staff and in the rooms. That we have enough testing, that patients are going to be tested before they go to surgery as we move through this plan. So right now, Blackhawk County doesn't qualify for expanded services, but we are looking at that because we want to be ready when we can get back to some semblance of normal, the new normal, as we talk about. Our teams have worked very well with doing this. We continue to work on the day-to-day planning of all of this, and yet we don't know if another surge is going to occur. I'm very nervous about that with seeing the numbers in the community increase like they have over the last week. So we are prepared. I'm in contact with Dr. DUCLOS, with Dr. GLASCOCK, with Dr. Adams on a regular basis to know what's going on. We're all in sync of trying to take care of the patients in the community. But we are here, and before we move forward, we will do so with safety in mind for the staff, for the patients, for the providers, so that we don't expose anybody. Thank you.
Our next speaker is the Regional Vice President and Medical Director for Unity Point Clinic, Dr. Dan GLASCOCK.
Good afternoon, everybody. Thank you for the opportunity to speak here today. First of all, I want to give a shout out to Sheriff Thompson. I think that your address was spot on. That's exactly where we are in the community right now, and I really appreciate your saying that. I'm here to share some of the updates regarding how we are addressing the trends that we're seeing in the community. On Friday, we opened our second designated respiratory illness clinic, and this clinic is at our urgent care location at North Crossing, which is on Logan Avenue, just near Allen Hospital. We continue to see an increase of patients at our respiratory clinic at our United Medical Park location, which we opened a month ago. And as Dr. SHARON mentioned, we are still seeing a high volume of patients, but we had that big rush that we kind of expected with the Tyson testing that we were doing initially. That has kind of calmed down because Tyson's doing their own testing. But what we're seeing now is that we're seeing a lot more healthcare workers. Healthcare workers are coming in and getting tested, and many of them are being found positive. And I don't know if you're noticing that in your locations as well, but it's really starting to affect the people that are on the front lines now. So it's at this point becoming a very scary situation. Our two clinics will work in coordination with each other. We'll share that same common phone line that we've talked about before. That's area code 319-833-5888. One other thing to note about the North Crossing respiratory clinic is that we'll have a pediatrician on site there Monday through Friday. So we'll believe this will greatly enhance our ability to treat our pediatric patients as the virus continues to spread in our community. On a related note, we have also suspended operations of our tent outside Allen Hospital emergency room. This is a result of actually more people calling into the clinics instead of going to the emergency room. So the patients that are actually showing up at the emergency department are people that really weren't being evaluated in the emergency department. So because of the relatively low volume that we were seeing through the tent, we're going to close that down for the time being and continue to direct our patients to the dedicated respiratory clinics where we're seeing our greatest volume. We've also been working on the criteria to resume elective procedures, as Dr. SHARON alluded to. So this work will be aligned with our efforts around supplies, our continued COVID testing, our PPE, and prioritize the health and safety of our patients, our team members, and the community. Finally, we are also looking at workflows to further evaluate our COVID positive patients. Presently, they are evaluated at the respiratory clinic, and if they meet the appropriate criteria, they're being tested for COVID-19 and then sent home. But as soon as we get the results, then we notify the patients and give them advice on how to best care for themselves. However, we are noting a trend that is particularly worrisome. Some of these patients that are becoming, that are COVID positive are becoming hypoxic or begin to deteriorate at home, and do so in a relatively asymptomatic manner until they reach a critical level and require emergent evaluation. We would like to identify these patients sooner and intervene before they need emergency evaluation, so we are currently developing some workflows around that. In closing, I just want to reiterate that our preparation has, I think, set us up as well as a community as we can to try to meet the healthcare needs of all of our patients. But we still have a lot of work to do, and we will continue to try to plan appropriately as this pandemic continues to run its course. Thank you, and be safe.
Our next presenter is the co-medical director at People's Community Health Clinic here in Waterloo, Dr. SHARON DUCLOS.
Hello, everybody. Well, let me give you an update for People's at least. I'll start with that. So, as everybody else has said, we continue to see sick people. We continue to see sick people in our respiratory clinic. We can continue to kind of go through that emotional roller coaster of what going through a pandemic takes. So I, like Nafisa, may get a little emotional. It's amazing how the pandemic affects people really differently. And thank God there are a lot of people that have not been personally touched by this. And thank God there are a lot of people out there that don't know somebody that has been personally touched by this. But for people who work in the healthcare profession, and for people who have worked in an industry that has had difficulties with working on social distancing, they are the front lines of this. And they've had to go through that emotional roller coaster of feeling the wave that's coming. Initially, you know it's coming. You're watching New York City. You're watching all that you go through, but you're distance away. You're seeing it, but not really feeling it. You feel sympathy. You're like, oh my gosh, that's just I'm so sorry for them. But you're still over here feeling A-okay. And then it gets a little closer. And then it starts to hit your community. And we knew, definitely at People's Clinic, because one of the things that you realize is a large portion of our population are underserved. They're already struggling with so many issues. They're already struggling with so many chronic care issues. And they are the front lines in industries that have difficulty with social distancing. So we knew when this started with travel, we all kind of estimated who was going to be the first person to diagnose the first COVID. I was just like, it won't be at People's Clinic. Our patients aren't traveling. What we knew is when it started, is that it would be a big impact on our patients, and it has been. And so we've gone through the roller coaster of getting ready, of spending hours of trying to change your process. We've gone through the struggle of how do we see someone who has a significant illness in order to help protect your staff. Part of being ill is also helping somebody emotionally and mentally with their illness. And it is hard to help somebody and educate somebody if you can't talk to them, if you're keeping your distance. And so you're constantly trying to juggle helping somebody, but again, working on social distancing. And then we saw the surge. And then we felt that emotional, okay, here it comes. This wave is now coming. Here comes the tsunami. And then you change a little bit more as far as working around how many positions can I change to really take care of this wave of people as they come in. And as you do that, then you're trying to take care of your staff who start to feel like they start to get sick. And so as the wave comes in, then you have a portion of your staff that's out because you're worried about illness and they don't feel well. So you get over that. And then people go into the hospital. And then finally, you start to see the deaths. And I think that's the thing that really gets you, is you see the impact on the family who have to sit at home and can't be with their loved one, who have to FaceTime as somebody is going through one of the most traumatic experiences of their life. We're going to FaceTime. I can tell you, I've never seen that before, ever in my life as a physician. I would have never thought that we would have to isolate people in order to help protect the bigger good. We're asking families of people who have been diagnosed as in the hospital to do the social distancing. That's harder than anybody else when we're asking to do the social distancing. So you see that impact. You see that impact on the community, and especially on an underserved community that have to deal with so many other lack of resources. And that's the part that finally gets very overwhelming. And I know in our organization, that is what we're feeling, and that's what I've been feeling. And it's hard because you start to go through the grief of realizing, again, this is not a sprint, it's a marathon. You have to set your mind to work on your stamina, to not understand how long this is going to go on, realizing peaks and valleys are probably going to happen. Our best resource is going to be a vaccine. For all those doubters, this is what will get us through this. It will be a vaccine to help us get over this virus. So as we start to move on, and the governor announces the opening, now more than ever, and especially in Black Hawk County, the social distancing is so important. And for me, it is, I think about what would the person say to me who just died from this? What would the family say to me who just died from this? How would they advocate helping other people not go through what they just went through? So that's what I think about. So for the other businesses, churches, restaurants, think about your community and think about your actions and think about how you can best serve the greater good and really, really work on social distancing. Because I can tell you, it is a heavy load to carry. And my biggest fear as I encourage my staff to come to work every day and be compassionate and help people. It's my biggest fear is I'm going to lose one of them, and that I have to carry on my shoulders because I'm asking them to do a service that I realize it is very hard. And I'm asking them, I know they've got that pit in the middle of their stomach, and you get up and you come to work and you think, okay, is this the day? Is this the day that the COVID bug is going to hit me? And you think about that every day. We talk about the unusual dreams people have. People are having a lot of unusual dreams because it's just subconsciously in your brain all the time, wondering if today is the day that it's going to get me. So please work on the social distancing. Please help people out so the number of deaths that we have to endure are minimized as much as they can. That's my plea today. Thank you.
We're going to now switch gears just for a minute and invite the Chief Executive Officer from the Western Home Communities, Mr. KRIS HANSEN, to join us via Zoom. So I'm going to move a microphone over here very quickly.
Boy, echo all of the words that you said when you started this off about social distancing and especially following Sharon and what folks are dealing with. I know my role today is to describe what's going on in long-term care a little bit and in senior living. First off, just a little bit of description about Western Home Communities and who we are, because we get lumped into just long-term care in our skilled nursing facilities, which we have about 225 beds of that in the Cedar Valley, but we also have another 250 apartments of assisted living, and then about 400 residents that live in a congregate independent living setting, and then another 400 residents that live very independent in patio homes. And so it's just hard to really message this as one operation, and in that we've got 14 different buildings. So, you know, when you hear that Western Home Services, Western Home Communities has 4 employees that have tested positive, we have, but we also have about 1,250 employees. So it really is about a community of 2,500 folks that we're trying to take care of here and trying to watch over and trying to do the best we can. And today we have 1 positive resident that's in our isolation unit. Unfortunately, we feel that she contracted that because of absolute medical necessary treatment that she needed to go out for. But that's what we have. And I just echo everyone, Sharon being the last one. We have to practice our social distancing. The community, I mean, we've got some major challenges there with Tyson, with, you know, multicultures around the community, language barriers. But our employees, their worst nightmare is to bring that into one of our buildings. And so it's just incumbent upon us as a community to do the very best that we can to practice social distancing, to just be the best we can be. And, you know, there's such conflicting message going on right now from a national perspective, even at the state level, opening up 77 counties. We are not going to be at the peak of this in our area. I'm not sure if it's moved, but I know it's somewhere around May 7th. So we've got another 10 days to try to get to the top of this. And unfortunately, there's also been, you know, I think wrong communication that the hospitals have excess capacity that's coming at us, and we might as a state. But the pressures that you've just heard the 2 medical directors talk about, they're real. And so as we sit, and Sheriff Thompson, I think we were together on March 30th, actually, talking about this and talking about how do we prepare for it, and trying to get everybody to social distance for this very reason, because the throughput that could hit the hospitals is going to get very tough. And the challenge we have is, you know, with 1,250 residents, and I do have, you know, first floor of Dairy Suites set aside, at least half of it for isolation. The challenge we get is if I bring somebody in there that's COVID positive, and all of a sudden, you know, it transfers to other residents, instead of relieving pressure on the hospital, we've just lit the tinderbox on fire, and we might overwhelm the hospital. So we're trying to do the best we can to manage that inside. I can tell you that our employees are screened every day as they're coming in, temperature taken, probably a dozen different questions, and down those questions are different decision trees on whether they should go to the floor or not. I think we all know that even 6 more questions came up over the weekend from CDC that go into that screening process as well. And then they're also screened on their way out, and temperature, et cetera, and how they're feeling. 2 of our employees that were positive positive have direct tie to Tyson. I'm trying not to throw stones here, but we've all got to be good community members. PPE, I've taken one of my senior leaders, and that is their whole job, is to try to secure PPE, and how we do that. Masks, face shields, etc. All of our employees are wearing them in our assisted living and in our nursing facilities. And again, right now, we are still trying to protect our residents from contracting it. What you've heard the medical directors talk about is folks that have it, so they're trying to protect their staff in both ways. So we're still at that crux. I would also tell you that any admissions that we take, they're quarantined or isolated for 14 days if they are, so that we make sure that they clear that hurdle. If anybody that has treatments, that essential treatments that has to go outside, they're put in that isolation unit as well. Again, trying to control anything to get to any of our other residents. You know, we've talked. I actually called the state, the Department of Inspections and Appeals, shortly after our first time together, Sheriff, and talked about, could we dedicate a building that maybe had some low census, and get those well residents out of there, and then really try to create a COVID geriatric MASH unit, if you will, if the need really arises. Because again, our folks being elderly and compromised, as seniors are in the community as well, we wanted to try to keep as much segregation as possible, and really create kind of a task force with the health systems to try to navigate that. And you know, it's so hard because you don't know what the surge is going to be. You don't know what you're really shooting for. And again, I believe there was a misnomer a little bit that, you know, the pressure, we had flattened the curve as a state, and so the pressure on the hospitals wouldn't be that great, and that we'd be able to handle it there. And I think that's still true across the state. The challenge here now is in the Cedar Valley and Blackhawk County, and making sure we can still do that. So we have conversations with leadership at Unity Point, also with Mercy One. But Unity Point, we've gone so far as to really talk about, is there a way for us to partner, take a portion of the hospital potentially. Again, we're waiting to see what the surge and what this all looks like. But instead of discharging to one of our health centers as long-term care providers, not just Western Home, and you know, it has the potential to expose other people, is there a way for us to really go in there and convert part of the hospital into a skilled nursing facility in partnership with us? We can do the billing, we can try to handle all of that. So we continue to explore that. We're heading up some legal to get their interpretation on that. I can tell you the Department of Inspections and Appeals agrees, because they're trying to mitigate exposure as we go forward. You know, just like Sharon just said, well, the others have said too, Dan GLASCOCK, now when it starts to hit, you know, we increased our pay for those that are on the front lines to really, you know, try to contain themselves out in the community. And we know that they're, you know, they've got families to raise, they're out in the community as well. But to really think through that, so we've put hazard pay almost on every position that we have. And especially now those that truly are on the front line, now that we have somebody positive as well. But when that really hits, it takes a whole different mettle in folks to stay there on the front line and to be there trying to, you know, deliver that care. And so again, it really starts to fall back on we as a community have to continue to do a better job than what we have. I see the posts, I hear the posts. If you can believe it, there was even death threats on if somebody with our staff. If somebody gets it and my mother dies, you'll die too. So we've dealt with some of those challenges along the way. But ultimately it does come back, and boy, Sharon, I can't plead any stronger than she did. Boy, stay home. Don't put our caregivers in harm's way by just going to a grocery store, because we all got to figure out how to survive in the community. But if we stay home, you will save lives. You'll keep our professional caregivers from being exposed, and then very unknowingly and unwittingly taking it into work, because it takes so long before things really present. And we just have to hang in there. We have to keep the thesis at it. And if you don't get emotional about this, there's probably something wrong with you. So all kinds of grace to them. But that's what we have to do. I remember Sheriff Thompson, before we went up a month ago, he said, I'm gonna get after him a little bit. And he did. And the good news was I was right behind you on the mic, and I just wanted to reiterate and try to take it up another notch, because not all seniors certainly live on our campus or anybody else's campus that's serving seniors. Are all out here in the community. And I remember the doctor down in Cedar Rapids, 5-6 weeks ago, saying to people, if you're going to come out in the community and you're not going to practice social distancing, then which one of your grandparents do you want to see pass away? And we just owe it to these generations to sit still for a little while and do the best we can. So we will keep we'll keep doing what we can. We work very closely with the folks there in the room with you, but it is a balance. Part of our folks are with us to live out, their retirement years and all the way through. But yeah, we have a position too here in the healthcare system, and so we're not shirking that duty. And we want to be and do the best we can, but certainly not put any more at risk than we need to. So thank you.
That concludes our prepared remarks, pending your questions.
Can you comment on the governor's reopening statewide of religious and spiritual gathering?
My comment would be that at least in Blackhawk County, we consider that, and we discussed this, all the medical doctors, all of the PhDs in the room, the poor little master's degree cop, knuckle dragon cop in the room. We all agree that we think that at least for Blackhawk County, it's premature. It's a challenge for us simply because we know that we're nowhere near spiked yet. We are still surging, and we recognize that any place that we allow or encourage people to congregate, we allow that COVID virus to propagate. And so for us, that's a dangerous mix, particularly when we are leading the state, yay, in COVID positive cases. It challenges us to continue to see that encouragement. In fact, we've already had some churches reach out. Thank you very much for reaching out. We appreciate that. We appreciate your partnership. But we would encourage, let's let that sit for a couple more weeks. Let's let this surge crash before we start entertaining those kinds of congregational opportunities.
What's the update in terms of Homeland Security coming in and setting up mobile testing, or the state strike team coming here?
So the question is, what is the update with regard to the state testing or the strike team coming in and setting up? I think that the strike team was used at Tyson, and so that is concluded. That testing has been concluded. The other testing that you're talking to or referring to, I also alluded to in my brief comments. That's called Test Iowa. And that is up and ready to go. I think we're going to do a soft open, all indications are, on Wednesday. And so Wednesday afternoon, we will do our soft open and brief run through In fact, we were talking with the National Guard before this briefing, kind of talking about what that looks like, probably Wednesday late morning, and then open up early afternoon, do the soft run-through and soft open that afternoon and be ready for business fully on Thursday. We hope that that's the way that's all going to work out. That's the way everything's pointing to at this point.
Do you have any details on that yet,
Do I have any details on that?
as far as location or time?
I believe anybody that signs up for it will get that information. What we don't need and what we certainly don't want to encourage is looky-loos, people that are just going to come out and mill around just to check things out. That's not the purpose of this. If you have genuine need to be there, then certainly there's opportunity for you to be there. But we're not even opening it up for a media expose sort of thing. It's just the purpose is to increase our volume of ability to test. And so that's our hope.
We have a question from Iowa Public Radio on the governor's steps to reopen more broadly. Neighboring counties to Blackhawk County will be able to see retail and businesses reopen. Do you think this mixed approach will negatively impact Blackhawk County?
With regard to our neighboring counties being able to open their retail, and I don't know that that was the message yet. However, in part of our proclamation, there are certain pieces of business that will be starting to open back up. So the anticipated, I think what the question is anticipating is, how do we see that impacting, right? That's the anticipation. And at this point, again, the knuckle-dragging cop in me says I don't care. Right now, what I care about is the 132 to 135,000 citizens of Blackhawk County that we know are in harm's way, that we know are significantly at risk, at greater risk than any place else in the state of Iowa right now. And that is painful, that is frustrating, and that just frankly makes me really, really mad. I just about said something that you couldn't air. So I don't care if Buchanan County can open their shops and we can't right now. I care about the lives and the safety of the citizens of Blackhawk County at this point.
Question for Nafisa, kind of a two-part question. I know last week we talked about how we were a bit backlogged on contact tracing. Do you have an update on that? And then of the Tyson testing, we said it's completed. How many of those results are still pending, if there are any still pending?
So if you think of it, Tyson, I think for their total number of employees is about 2,700. And so for the health department, and I have to say thank you so much to the staff who've been working nonstop doing the contact tracing Monday through Sunday. It's been a lot of work, and so but we've been able to manage all the cases that we've received up till Monday. And so some of that has been also some of the cases at Tyson. The highest volume of cases we've received since the Tyson outbreak in one day has been, I believe, 167. And so on average, we're seeing about 86, which is really beyond our capacity. So the state is going to step in and do the contact tracing for us until there's a certain threshold that we reach and we can continue to do. So with the testing that occurred at Tyson, usually since it's through the state hygienic lab, it takes about 48 hours to get some of those results. Mm-hmm.
So there could be
Some, yes.
How many Blackhawk County residents have been tested so far?
How many do you have that total number, Josh?
Not readily available.
2,500?
2,500.
That's a state data point that the state has access to that the locals don't have this ready access to.
I think it's just over 2,500.
Of this new increase that we saw, taking us up to 1,346, do we know like a percentage or how many of them came from testing this weekend at Tyson?
So of the new cases we've seen in the last 48 hours, how many attributed to Tyson? So if you recall, about a week ago, I've talked about since the outbreak, we've seen a huge amount of our cases either confirmed from Tyson or Tyson related. And so I would say that over 90% of our cases still from Blackhawk County are Tyson related in some shape or form.
Have you heard from them on a timeline for reopening, or have you had any discussions about when would be appropriate for that?
No, not at this time.
You said that we're still seeing the surge. I know this is a very complicated question. I don't know if this is for you or more so Josh, but do we have any better sense as to where we are on the curve as compared to last week when that question was posed?
I would say we are increasing. Yeah, we are still increasing up.
Not in terms of deaths, but I know Dr. GLASCOCK talked about how more of our appointments are healthcare workers. Has that impacted at either Unity Point or Mercy One staffing levels whatsoever?
So the question is, has the incidence of healthcare workers coming down or testing positive for COVID-19 affected our operations? And the answer to that is yes. I think that we have providers that have tested positive and have to be out. We have nurses that are being exposed to it. We have lots of people that are getting tested now. And it's not just Unity Point Clinic. It's healthcare workers across the Cedar Valley. So it's every one of our organizations. And the nursing homes and anybody that's involved in healthcare, that's where we're starting to see the numbers start to climb. So that's a major problem. And as we continue to see surge in the hospital, we are moving more resources and more people into the hospital to try to address the care that our patients need there. And they're doing the same thing at Mercy One. So that's taking more nurses and staff and putting them directly in harm's way. To take care of the patients that need to be taken care of. And I also want to go back to an earlier question that talked about, the counties that surround us. There's nothing magic about a county borderline. So, the reason why we don't see so much spread in the counties around us, some of the counties around us, is that their population density is a little bit less than ours. But if you take a look at Tama County is a very rural county. But it just takes one little nidus, one little spark to really set it off. And Tama County has a huge number compared to some of the surrounding counties. So there's nothing magic about the county borders. If it gets outside of Blackhawk County, well, it already is.
Dr. GLASCOCK, Iowa Public Radio asks, do you have a sense of how healthcare workers are contracting the virus, and is it from community spread versus contact with infected patients?
So the question is for healthcare workers that are coming down or testing positive or having symptoms and requiring testing, is it community spread or is it from direct contact with infected patients? So I would have to say that it's both. We know that there is community spread. It's going on in a lot of different areas. We also know that there are a lot of healthcare workers that have family members that work at Tyson. So you get it at Tyson, you bring it home to your family, and now you have 6 or 7 other people that are affected by it. So it's a combination of both. It's definitely community spread, but we're also and we're doing everything that we possibly can. With the protective equipment and the gowns and the masks and everything that we're doing to try to prevent the transmission or getting it because you're taking care of an infected patient. But nothing is 100%. So, we're all at risk for this, no matter how much care we take.
You mentioned new workflows, and I'm going to admit you used a term that I'm not familiar with. I think hypoxic? Hypoxic. In regard to those new workflows, you said that so many folks are deteriorating at home, but they are asymptomatic. With that in mind, with them being asymptomatic, is there any sort of guidance or advice you can offer to those folks to kind of be aware of? Any certain thing that pops up?
So what hypoxia is decreased oxygen saturation. So as this virus gets down into our lungs and starts to affect our pulmonary function, you will see a deterioration in your pulmonary function, and you'll see a decrease in your oxygen saturation over time. And clearly this doesn't happen to every patient, but it happens to a number of patients. And they are relatively asymptomatic. They feel okay. They feel a little bit more short of breath when they're up and doing things, but they will actually have quite low oxygen saturation until they reach a point where they are critical. One of the things that I'm hoping to do is to develop a more robust follow-up plan for these patients. So if they have a positive test, we're usually calling them a couple days after they get tested, because that's what the turnaround time is. So it's an opportunity to reconnect with them and tell them, yes, you have a positive test. How are you doing? Are you feeling more short of breath? Are you having more fevers? Are you having any new symptoms? So then we can take a look at those patients who are positive and, figure out a way of getting their oxygen saturation measured so that if they're starting to hit that curve where their oxygen saturation is dropping, we can get them more acute care before they are emergent and need to go to the emergency room.
And Dr. Nafisa, we have another question from Iowa Public Radio. Can you comment on how Governor Reynolds' phased reopen of neighboring counties could impact the spread in Black Hawk County?
It does. It has an impact on Black Hawk County. If you recall, for Johnson County, it was a cruise ship that had an impact in terms of their increase in the volume of COVID cases. And so with us also, we've seen just people traveling, and that's why we've always said, when you travel into county or you return back, to self-isolate for 14 days. So community spread is here. It's been here. And so I think that one of the things for me, for the residents of Black Hawk County, all I can say is continue to stay at home, continue to do your part, that we will get through this. And, the most important thing is for us to understand that our peak is still here, here in Black Hawk County.
Can you comment on the PPE stockpile and if there are any shortages at any facility?
So the question was the PPE stockpiles and any shortages that we made of note. So every morning we have a staff briefing, and then at 1 o'clock we have our planning meeting. And so one of the first things that I asked when I got here this morning was, where are we at PPE-wise? Where are we at testing kit-wise? And I asked each of the hospitals and clinics, as well as the long-term care facilities, where are we at, green, yellow, or red, for their testing supplies as well as their PPE supplies. Everyone across the board told me they were green for both testing supplies as well as PPE, and I've got PPE as well as I've got PPE sitting here. We are getting ready to put in an order tomorrow because we are anticipating that additional draw in the next 2 days, and it usually takes 2 to 3 days to get that PPE here. So we're trying to be on cycle with the drawdown that we'll have this week so that we can replenish by the weekend so that we can have it here before the next draw. So we look pretty good right now.
Was that a 48-hour spread or a 7-day spread?
That will continue to be. Again, we hope that because Tyson is now tested, unless something strange happens with long-term care facilities, which we're starting to pay attention to pretty closely, we're hoping that we're starting to see a narrowing of the draw because of the Tyson cases. So I'm hoping to be able to say definitively that we're back to a 7-day PPE forecast instead of, a 2 to 3 day PPE forecast.
We have a question from Iowa Public Radio for the medical directors. Are there efforts to rework hospital and clinical staffing as healthcare workers fall sick, such as marshaling non-specialists for COVID care, or a need to send healthcare workers from other parts of the state?
At this time, we are working with our Mercy One partners and in contact with them if they have resources or ability to help us out as we move through this. At this time, Sioux City is getting a surge also, so that's one of our Mercy One and Unity Point partners as they work through that. And so here in the community, we are marshaling our numbers. Mason City and Dubuque have had lower numbers, so we are discussing with them if and when we reach that need, what does that look like? I will answer one other question earlier about the follow-ups. We've been using our health coaches for follow-ups on all our positive cases until they are cleared. So every 2 to 3 days, they are getting a phone call and asking about symptoms, what's going on. One of the real difficult parts is what we call that happy hypoxic that Dr. GLASCOCK alluded to. That patient's breathing okay, but they are short of oxygen and they don't know it. So if an individual that you know has tested positive and changes the way they're acting, they're not getting out of bed, they're just not as energetic, that's when they need to be rechecked. Not just that they're short of breath or have the pain, and that if they're confused, that is another one of the symptoms the CDC just put out. So be aware of that, encourage them, because they'll sit at home and go, I'm okay, I'm just more tired today. No, they need to be seen if there's a change in their status.
That concludes today's briefing. Thank you, folks, for your attendance. I appreciate it.